Remember, we'll be taking questions on these two talks after the second speakers. Next speakers are from the USDA, Eve, Essery, Stoody, and Giulio Baggi. Systematic reviews for the Dietary Guidelines. Thank you.
Excellent. So thank you, and thank you for inviting us back again today. So what we've been asked to do is to provide a case study for a systematic review from the Dietary Guidelines. And so what we've chose to focus on today, and I think it'll complement both of the presentations that have occurred so far, is looking at dietary patterns and from the 2015 Dietary Guidelines Advisory Committee process. And so I'm going to quickly start today talking about the first part of the process, topic identification, refinement, and prioritization for the topic of dietary patterns overall. And I'm going to turn it over to my colleague, Dr. Giulio Baggi, who will talk about more specifically the systematic review, the Nutrition Evidence Library systematic review for the question of dietary patterns in the risk of breast cancer. So as we have talked about previously, the process to update the dietary guidelines includes 4 primary steps that you see here. And what we're talking about today is really focused on the second step of the process, in which the advisory committee reviews science and produces an advisory report. And as Dr. Millen has already spoken about, there were a number of different approaches that the advisory committee used to review the evidence, one of which Dr. Baggi will talk about next, Snell systematic reviews. And then later today, Dr. Patricia Britton will be talking about food pattern modeling analyses and briefly about data analyses. So an important part of the advisory committee process is determination of the topics it will address in its report. And as Dr. Millen noted, as noted in their charge, the advisory committee is asked to review the most recent edition of the dietary guidelines and determine topics for which new scientific evidence is likely to be available that may inform revisions to the current guidance or suggest new guidance. The advisory committee then, through working groups or subcommittees, identifies, refines, and prioritizes its topics of interest. And then these topics are deliberated with the full committee in public meetings. And as with the entire advisory committee process, this aspect of the process is open to public comment. And so for the next several slides, I'll walk through the specific case study of dietary patterns with the 2015 Advisory Committee. So as Dr. Millen noted, they started by looking at the 2010 Dietary Guidelines and the associated 2010 Dietary Guidelines Advisory Committee report. And dietary patterns was a main feature of the 2010 Dietary Guidelines. It was one of the 5 main content chapters of that edition was building healthy eating patterns. And the 2010 Advisory Committee addressed questions related to this topic. And so the advisory committee really determined early on, as Dr. Millen noted, that dietary patterns, they felt like this is an area that the research continues to grow and evolve, and there's new research, and so they determined really early on that this was a topic that they were going to address. And in fact, during the public meeting, they identified dietary patterns as one of their primary topic areas. So once they had done that, the advisory committee and subcommittees and working groups continued to meet, and they refined their exposure and outcomes of interest. And so when we're looking at the exposure of dietary patterns, as I think everyone knows, that this can be a really, really complex intervention, talking about what, when, how, many different aspects of how people eat, what, how much, and where. It can also include some different aspects of lifestyle. And so they really refine what aspect of this are we going to look at. And they decided to focus on the definition that you see here. So they were looking at the quantities, proportions, variety, or combination of different foods, drinks, and nutrients in diets, and the frequency with which they are habitually consumed. And they further stated that this would be defined based on the method of assessment of diet exposure, whether that be an a priori pattern, data-driven, or other method. Similarly, they talked about a number of different health outcomes. So when we're talking about health outcomes, there's obviously a lot of health outcomes that could be considered. And this list here is a list of some of the outcomes that they discussed. Measures of body weight or obesity, risk of cardiovascular disease and type 2 diabetes, incidence of metabolic syndrome, risk of certain types of cancer, neurological and psychological illnesses, bone health, risk of birth defects, infant birth weight, preterm delivery and pregnancy complications, as well as the density, type, and diversity of the gut microbiome. Now, as Dr. Millen noted, this is a time-limited process, and those are a lot of big topics, and dietary patterns was one topic within a number of other topics. And so they then did an activity to prioritize exactly which of those outcomes that they would consider. And they prioritized topics in relation to public health importance, as well as the potential to inform food-based dietary guidance. The advisory committee went through a process of multi-voting, and as Dr. Millen noted, they developed tiers of outcomes. So they had a first tier, second tier, third tier, and they also had emerging topics. And so what you see here are slides from the second public meeting, and on the left-hand side are the outcomes, the health outcomes that they identified as their first tier. And so these included cardiovascular disease, type 2 diabetes, obesity, colorectal, breast, prostate, lung cancer, neurological and psychological illnesses, specifically Alzheimer's disease and depression, bone health, and birth defects. And on the right hand of the right hand of this slide, you can see the slides that they presented that indicated some of their second and third tier questions, as well as their emerging topics. Now, as I noted, throughout the entire advisory committee process, public comments are accepted, and what you see here are some of the example public comments that were submitted to the advisory committee related to the topic of dietary patterns. And some of these topics were were broad, encouraging looking at a total diet approach, looking at dietary patterns. Some of them were more specific, pointing out particular dietary patterns, such as a whole food, plant-based diet or a carbohydrate managed approach. So I do want to note the advisory committee did look at those public comments throughout the process. So it wasn't something that was just, they were continuously received, but they really did throughout the process have periods where they focused on and reviewed those public comments. It wasn't something that was, just saved for the end. It really was a part of the process. So as Dr. Millen and we have presented on before too, the advisory committee then develops questions for each topic and determines the approach it would use to answer each question. And so again, those are the four methodologies there on the left, and the arrows indicate an example question that was used for each of the different methodologies, and it related to dietary patterns. And then the advisory committee took that collective evidence from all of the different questions to inform their recommendations around dietary patterns. And so now I'm going to turn it over to my colleague, Dr. Julie O'Baggy, who will walk through that specific example of dietary patterns and risk of breast cancer.